everybody and welcome back. This is DrMridulaVAmarnath here. So I know as you're approaching towards your expected date, you have a lot of, thoughts traveling in your mind. So one of them could be whether would you have a normal delivery, or would you require a C-section, or would you even require a forceps or a vacuum delivery. I'm sure you must have heard, a couple of your probably relatives, elderly people, they would have told you, we've undergone a forceps delivery or a vacuum delivery. But do you know what exactly it is or why they would do that? Well, to know more, stay tuned.
So this vacuum device is a small plastic cup that fits over the top of the baby's head and is attached to a vacuum suction. Whereas forceps are two metal spoon-like instruments that are placed on either side of the baby's head.
So now both these instruments are mainly useful for guiding the baby's head out of the mother's pelvis.
Now they may be used when the mother cannot push the baby out by herself. Now she may not be able to push effectively either because of exhaustion or probably a numbness due to an epidural. Or perhaps she is in the process of early pushing, but due to fetal distress, the baby needs to be delivered urgently.
So, generally if you take a study, it will see that most of the women, they prefer a normal vaginal delivery. And only, hardly probably anybody would prefer to go for an instrumental delivery or a vacuum delivery, because certainly these kind of delivery modes have its own, negative impact either on the baby especially. Okay, so that is why in spite of knowing these impacts, you wouldn't want to go for that. At least in the previous, probably 10-15 years ago, people didn't know the negative impact of these instrumental delivery. So they would, whatever the doctor said, they would, go with it, and probably that was the procedure. But nowadays, if you look at it, very few people actually opt for this instrumental delivery. But after, several hours of pushing, and in case if there is a fetal distress, then having a vaginal delivery might become a little difficult. So the next option is always an instrumental delivery. But that is only done, probably making note that both the mother as well as the child would be safe and they would not be in danger. And third option is C-section. But like I said, nowadays the second option is kind of, being slowly eliminated, and people either go for vaginal. If it's not possible, then the next option is directly to a C-section. So you must be wondering, why is it so? Why do people opt for, a C-section rather than an instrumental delivery? Because in C-section, it is actually a proper procedure. You make a incision and then you deliver the child out. Whereas in your instrumental delivery, there is nothing of that. So you're just using an instrument and then trying to pull the baby's head out of the mother's pelvis. But why is it still not opted? Why do still people do not prefer to go for it?
That is because instruments can cause a lot of damage to the baby. Either it could cause a compression of the baby's organs, or, while bringing the baby out, there could be, a damage to the nerve, and which can actually lead to a lot of other subsequent defects in the baby. Apart from that, now these instruments will also require proper training and skill to use. Now, if you do not get a proper training during your training course to use these instrumental deliveries, then it becomes very difficult. And also, in light of the medical and legal environment, today many practitioners prefer to perform a C-section instead of using a vacuum or a forceps.
Well, so you must be wondering, what would I opt for? Personally, if you ask me, my first option would be a normal vaginal delivery. But again, if the mother is, having a lot of stress and is not able to push any further, or if there is a lot of distress in the fetus, then my second option would directly be a C-section. I would never think twice to even, go for a forceps or a vacuum delivery. Because like I said, nowadays a lot of doctors are not trained in that, because a lot of legal and medical issues, the doctors even do not want to get themselves trained in these kind of instrumental deliveries. And I have seen personally so many cases where the child in the womb is absolutely healthy and you're expecting a normal healthy baby outside. But because of these delivery issues, the child had to be taken out by forceps delivery. the child has had so many issues. One of his nerve got damaged, and then his right hand was permanently paralyzed, and that is quite disheartening, quite sad. And then it turns into a medical legal issue. But then does it really help your child at the end of the day? No, right? You will be just running behind this court. It's not going to help your child. So personally, you ask me, I would recommend that you go for a normal vaginal delivery, and your second option should be a C-section. Okay? Anyways, you can discuss this with your doctor, personal doctor, but I'm just giving you my point of view. Okay? So stay safe. Thank you. Bye-bye.